There's still so much that you can do to shift and reduce it. But for healing our next generation of people, we as people, as mothers and fathers who are trying to bring the next generation into the world, we need to be more conscious of that, because in the 80s, 90s, we weren't. And now we're seeing the consequences of that with all of these little babies who are now grown up and trying to have kiddos. And so it's not just immediately what's happening, it affects everything because they're endocrine disruptors. They disrupt our hormones. And the most vulnerable time that our hormones are being impacted is in utero and during puberty.
Welcome to the Birth Education Center podcast, hosted by myself, Care Messer, an entrepreneur, birth educator, and doula. My team and I want to help you discover your options in birth and postpartum, how to find your voice, and how to use that voice to navigate our maternal healthcare system. You and your baby are not just a number. This information includes doulas too. Now let's get started. I am really excited today to welcome Dr. Leah Gordon here. Dr. Gordon, I've known you for a long time, and all of your friends, coworkers, etc., and everybody who came out of Bastyr, I think. She is a holistically mind problem solver. And as a naturopathic doctor, what I really like about what she does is she goes to the root cause. She's not a symptom fixer, and I think more naturopaths are root cause than not. But she works with fertility. And the thing that I really like is she talks about fertility instead of infertility, which as a hypnotherapist, words are so important. And I have moms come in all the time saying, I'm infertile. And I'm like, you're reinforcing, let's go fertility. Like, what do you want to create instead of what you're scared of or what you're in the mindset of? So I love that you use the word fertility all the time, because that is the goal, is how are we shaping our fertility earlier rather than later? And as someone who had 6 miscarriages before they figured it out, I have the MFTHR gene. So that was a whole thing back in 16 years ago that no one was even looking for. So I understand both sides of it. And I'm really excited for you to help people figure out their stuff earlier rather than later. So this is going to be a podcast that you send to your friends who might think of having a baby at some point. Send this to them earlier, because what we're going to cover today is exactly what they're going to need a lot earlier. So welcome, Leah.
Thank you. Thanks for having me. I'm so excited to be here and to help anyone who's listening. And that's why I'm here. That's why my journey has been the way that it is, I think.
Right? Because there's no chances with that. And I
Yeah.
do want to mention that on your website, you have a fertility quiz. So you can go and take that free fertility quiz and see where you are in your journey and where you need to start next. It's a fantastic tool. So I appreciate that you have that on there. It's womanhoodwellness.com/quiz.
Yep.
Is that right?
Yep.
/quiz.
Sure.
Then I'm going to have all of her stuff linked in the bottom for you to be able to find her. But I want you to talk about your soapbox topic, because I have the exact same soapbox topic, just on birth education.
Yeah.
And
Oh my
yours
gosh.
is just, it's the exact same one. I'm like, wow, just mirrored. Do 2 different topics. So can you tell me about that?
Yeah, I mean, gosh, there's a couple things that go into the soapbox topic, but I would say the first and foremost is the inappropriateness of how I feel our culture and our medical system approaches fertility, because it's very reactionary, which is how our medical system approaches everything. There's not a lot of preventative approaches. And for people who want to have a baby, there's no investigation, there's no optimization, there's no education around anything, how to eat well, how to balance your hormones, how to even know if there's a problem with you or your partner. There's really nothing. It's just like, oh, try for a year. Most people don't even know when they ovulate. So they're just having sex randomly.
Lack of education. Yeah. Having sex randomly. And the window is so tiny. And they just think, oh, it happened on the first try. And I'm like, then that was a freaking miracle.
Yeah, I know. Every time someone gets pregnant, just without any knowledge, I'm just like, wow, that is amazing. And it does happen for sure. And so people hear those stories and they're like, oh, it's going to be easy for me. But unfortunately, it's not for so many people. 1 in 6 now struggle with fertility. That's a lot. And it's rising and it's crazy. And so these couples, either a woman maybe isn't even coupled, but she wants to have kids, she can start that early, looking at her fertility and making sure that her hormones are balanced and learning her fertile window and all of that. But even as a couple, if they want to start trying, There's really no guidance, support, education, or anything. There's no investigation. If you go to your doctor and you say, I want to have a baby, they're like, okay, cool, start trying, you know?
Do the doctors even have any kind of, because I know even when I've talked to my doctors about hormone support, they're like, it's kind of hit or miss. And I'm like, really? Because if I go to a naturopath, there's a whole formula. What are we
Yeah.
missing in our medical system that we don't realize the components that make up fertility with nutrition and
Yes.
exercise and blood sugar and diet, like everything?
Yeah. It's not something that most conventional doctors know, which is really sad because that is the foundation of health. And everything's so segmented in our medical system, which I understand the pros and cons. If you need to have brain surgery, you want a brain surgeon who knows the brain and surgery very well. But we are missing that component in our medical system of the practitioner and the doctor who understands how it all fits together, how everything is linked. If you're an endocrinologist, you study hormones. But if you're a gastroenterologist, you're a gut doctor, you don't know anything about hormones. Yet the gut is intimately connected
Oh,
to hormones. And it's like they should have cross communication and they don't. And even if you go to an endocrinologist, they aren't going to understand diet because they're not a nutritionist and they maybe had an hour of nutritional education in their training. Yet diet is a huge foundation for what's affecting hormones. So everything is very segmented and disconnected. And fertility is, fortunately and unfortunately, fertility is a side effect of optimal health. Yet our culture and our medical system are not designed to help people have optimal health. So it's not shocking that so many people are struggling with fertility because this isn't a disease or a diagnosis that you take a pill for. And a lot of our medical system is designed on if this test doesn't result in a diagnosis that we have a drug for, we're not going to run it or we're not going to spend time to understand it, and it just doesn't work that way with fertility. Fertility is a complex, beautiful, magical, mysterious orchestra of all of these things being in the proper place. And understanding all of those places and how they all work together is something that's just missing. And that's what we do, right, as naturopathic doctors and certain functional medicine practitioners, but it's not the norm. And it's not what's covered by insurance.
which is astronomically the wrong end of the scale to be on.
100%, because
Ugh.
at the end of the day, you would save so much money. Like, the industry would save money if they did more preventative
The
medicine. That
insurance companies would save money, like
exactly.
drastically amounts of money. Yeah, it's
100%.
so wrong on so many levels. So
I
crazy.
know. And you get into it and it's like, why is it like this? The politics and the money. It's just like, yes, we could get into the why is it like this, but the reality is it is like this. So insurance is based on disease model. So, for example, if you go to your doctor and you wanted to do testing, let's say you wanted to test your partner's sperm or you wanted to test your hormones, they're going to say, well, I don't have a diagnosis code to run these hormones to bill
No
insurance.
CPT code. Don't know what I'm
Yep.
doing.
Sorry. So you have to wait, quote unquote, wait for the diagnosis of infertility in order to do any testing. And that diagnosis doesn't come until you've been trying for an entire year. If you're over 35, 6 months, but still, that's a long time to just try when my perspective is not only should we be investigating fertility early to identify if there's any problem, but it also helps us to identify places where we can optimize because fertility isn't just about getting pregnant. It's about getting pregnant, staying pregnant, as you know. That's a huge obstacle. 1 in 4
Yep.
women will experience a pregnancy loss. And then having healthy children. And the health of our children starts before conception and the health of the egg and the sperm. And this all happens through epigenetics. So basically, it's how your genes turn on or off based on what you're exposed to, your diet, your lifestyle, toxins. And it's very clear, the studies are very clear that the health of a woman and a man before they conceive impacts their child's health, their children into their adult life. So whether their child develops heart disease, cancers, asthma, eczema starts before they ever conceive. That's amazing and mind blowing. And why we aren't making that preconception or the time before conception the most precious time of a couple's existence is just crazy. The amount of time, money, and effort that are spent on like planning weddings
Oh,
versus planning getting pregnant. And I'm sure in
humanity.
your world, yeah, giving birth, it just everything in our culture is very backwards. So that's like my first soapbox is that we don't investigate fertility, we don't optimize, and it's not a part of our culture or our medical system to help these couples before they are quote unquote diagnosed with infertility. And even then, that's like another soapbox. We don't really help them much there either.
Well, exactly. And I go back to I want you a year before you're thinking of having a baby, 2 years
Yep.
before you're thinking of having a baby, because yes, they can start on this fertility optimization thing, but now we can also talk about the spirituality and the
Mhm.
emotional aspect of bringing in this other baby, this soul from wherever they're coming from,
Yep.
and how they're going to be nurtured in your home.
Yeah.
What stuff do we need to work on? So you can be working on the physical and the emotional so much earlier if
Hmm.
you just take the time to think about it or ask people we need to share that earlier as we're in parenthood. Oh my gosh, I wish I had done this earlier. We
Yep.
aren't sharing it. We're just caught up in what we're into right now.
Yeah.
And I think that's a disservice to our friends,
Yeah.
society, because it
100%. I just want to paint the picture of two different scenarios. So the current scenario is a couple is like, okay, I want to have a baby. They start trying, it's not working, no support, blah, 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 whatever. A year goes by, they go to their doctor, they're diagnosed with infertility, very commonly unexplained infertility, which means nothing's wrong. We don't know what's going on with you, which is not true. It just means you're not looking in the right places. And then most of them are shuttled to fertility treatments, whether that's hormones, they're given Clomid, letrozole, whatever, or IUI, which is intrauterine insemination, where they basically concentrate the sperm and inject that medically or IVF. And even if these couples go down these paths, if they're even able to, because it's so expensive, a lot of people can't even afford to do that. But even if they're able to, there's no optimization of their health, of them as a partnership, and this drains their pocketbook, it drains them, it adds stress. A lot of times there's a lot of discord in the relationship, there's fighting, there's all of this stuff. It's not good. So then these babies are, if they're lucky enough to be born, they're maybe not as healthy as they could have been because there were reasons why this couple couldn't conceive in the first place. And there was no improvement of their health, of their lifestyle. And then this family unit starts their life together in a less healthy way, right? Maybe the mom and dad didn't deal with all of their stuff that maybe came up. And then it just turns into this whole spiral of less health, less knowledge. And then the children grow up in this environment. Not to say everyone who goes down that path has that, but I'm just saying this is like one situation versus what if a year before people want to have a baby, they learn how to eat. They learn how to clean up the toxins in their life. They learn how to have a better relationship with each other. They work on their baggage. They
sorry, I keep nodding because I'm like, yes, please,
yes,
yes, please.
they're intentional with this preparation, just like the year a lot of people spend planning a wedding. What if we spent this year preparing not only our bodies, each of our bodies, but our home environment, our mental, emotional health, and our partnership together. And then whether you have to get help in the conventional model or not to conceive, because someone like me, we had to do IVF because of severe male factor. There was no other option for us. And that is a reality for some people. But so many people don't need that help if they actually worked on all of these things first. And then now this baby's being born into this beautiful environment that's much healthier. The couple is stronger because of it. They've dealt with a lot of their own stuff, so their parenting is maybe approached a little bit differently and just the preparation. I know we talk about this in the birth space of preparing for birth, but the preparation of preparing for becoming pregnant to me, like, it shifts the entire trajectory of not only a woman's life, but her entire family unit forever, and it's such a golden opportunity and a window that is just so sad to me that is completely neglected, and so that's my soapbox. It's I just wanna shake everybody.
Absolutely. And if we start with that, the preparation for birth, labor, postpartum is going to be
Yes,
totally different because
100%.
it's the intentionality of it, which it's just going to be a sacred, sexy, amazing, connected journey. And
Yeah,
that's where our babies are coming into. Oh my gosh, if I could wish that on everybody.
I know.
Because my parents tried their best. Lack of education. We didn't even know scientifically what was going on back then, right?
Right.
You're giving me 2 weeks in, 3 weeks in, rice cereal, so I'll sleep through the night. Wow, that was a miss. Thanks, guys. Why I'm so chubby? I don't know, because I ruined my gut from a very young age. And how many rounds of antibiotics did I do from the time I was 0 to, like thousands of them? There's just a lot that when you put the intentionality in the beginning with the fertility journey, it's going to make my job much easier because parents come in with the intention of, okay, I've been nurturing this baby for 4 or 5 months now. What's our next step? Yeah, we could both just stand on those soapboxes together.
I just think back to my education. I went to public school, and the amount of time that I spent reading books that meant nothing, taking classes in, like, algebra, calculus, the amount of time spent in school doing homework for years in subjects that, in my opinion, were sort of pointless. Imagine if we just took a fraction of that and taught people this stuff, because we don't learn any of it. We are not taught anything about how to be healthy, about how to have emotional regulation, about how to have good interpersonal skills, how
We don't even have
to
life skills.
like,
Home ec was
literally
not a life
nothing.
skill for me. I loved it. It was really fun,
Yeah,
craft class, but that wasn't a life skill. What about budgeting? Can
I
someone tell me
know.
how the stock market works? Because that's a scam.
Oh,
Give me information on how I can actually work to perpetuate a healthy, happy life. And I understand the system's not set up for that,
I
but
know.
oh my gosh. And I love that my parents are coming into class
Yeah,
doing that. It's definitely shifted from 16 years ago to now. It's a whole different generation of parents,
that's
even though they're all
that's
still
great.
millennials.
Yeah,
Totally different.
totally different, but that's where the breakdown is in the system, because where do people learn about this? Where do people, learn that it's important to prepare before pregnancy? Nowhere. I mean,
Tribes, we learned it in our
yeah,
villages and tribes
yeah,
like
back in the day
200,000
we
years
did.
ago.
Right. So that's what modern podcasts are and social media, unfortunately, because it's not gonna happen in the current system that is happening in our world right now, but it's not rocket science as to why so many people are struggling creating families and why there's so much depression and dysfunction and just all the things that are not ideal that are happening in today's world.
And all the things. And I do want to mention that Leah's the co-host of Healthy as a Mother podcast. So if you do not follow them, you probably do, or you wouldn't even be listening to mine. They're amazing and they're hilarious to watch. And I've known them both for a really long time. So Healthy as a Mother podcast, go follow,
Thank you.
listen, and you'll be drenched in information. You'll share it constantly. It's absolutely amazing. I would like to know, because our system we've just established is bleh. So,
Mhm.
what system of support would you start people? Like male and
Yeah.
female? Because a lot of people, I want to talk about male factor infertility. We'll talk about that in a little bit. But where do you start that couple with a
Yeah.
supportive system? Where does it begin?
It's such a great question. And so this is again where there's a breakdown of, okay, what do I point people to get support? And that's where a lot of times people are going to have to find it in situations outside of the current system. It's not going to be at their primary care doctor, unfortunately. If you go there and they're like, I'm ready to work on my diet and learn about all of the things I need to do, they're not going to have resources for you, unfortunately. I wish that was different. Maybe one day it will be. So finding people like me or Dr. Morgan or other people in the space who are knowledgeable and are credible, who are teaching this stuff, like learning podcasts and stuff. But as far as what to learn, the foundations of health are first and foremost. So, like I said, fertility is a side effect of optimal health. How do we have optimal health? It starts with the foundations. Foundations include things like diet. If you're clueless about what to eat and how to eat and what foods are better for your body and all of that's a great place to start. Learning about toxins. Unfortunately,
Oh,
toxins are,
toxins.
ugh, I know they're a part of our world. You can't avoid them 100%. I wouldn't want anyone to try because that will just create more stress. But being aware of that air Glade plugin that you have in your wall is hurting you, so let's throw it away.
Or the little tree that's hanging in your car. Oh my
Yes. Oh my
gosh.
gosh. I see people or I get in an Uber and I'm just like, Oh my gosh, stop." Like, things like becoming educated on where toxins are coming from, what products to choose and not choose. Things like the Environmental Working Group has resources, so ewg.org. They have a lot of resources on different toxins. There's a lot of apps that you can download now, like Healthy Living is EWG's app. There's Think Dirty. There's, oh my gosh, there's something called Switch Swap. Oh my gosh, I'm totally messing it up. But there's another app out there that will read the ingredient labels with AI and basically tell you if it's safe or not. Because
Well,
some of
and
these,
we're talking everything from what you put on your face and your skin, like
yes.
any kind of product that way, under your arm with the aluminum, whatever, all of that,
Hmm.
plus plastic water bottles.
Yeah.
Like you're dumping microplastics into your body every time you're drinking out of those water bottles. Even how we're doing baby food in those little packs that we heat and cook the baby food in plastic lined foil. Yeah. The more I learn, the more I'm like, I should stay off TikTok. I should
I
just stay
know,
off
but it's
TikTok.
not that hard. So it sounds hard to someone who is not familiar. Oh, it's Switch Natural. That's the app, Switch Natural. It's really in one of my courses, I break down how to clean up toxins in a really practical, budget-friendly way. But the first steps, just for someone listening, is to evaluate where you're using plastic. Plastic water bottles, plastic Tupperware, or food containers, and just choose different alternatives, glass, stainless steel, that kind of stuff. And then looking at fragrance. So, fragrance is in so many things. And if you actually look at the back of a label of something like a shampoo bottle or soap or whatever, if it says the word fragrance or parfum, which is like the fun, fancy way of them saying fragrance, basically it can contain phthalates and all sorts of toxic chemicals that they don't have to disclose that greatly impact our fertility. If you just get plastic and fragrance out of your life, you have done the majority of the work of getting cleaner
Really?
products. Yeah, so fragrance is in our laundry detergent, trash bags, all of the scented things like Glade plugins, air fresheners, shampoo, conditioner, body washes. If you just are choosing items without fragrance, you're already gonna be choosing brands that are more conscious because it's the conventional, more toxic brands that are using things like fragrance. So if you can just start evaluating that and getting those out, you're going to be doing yourself a great service. Like I said, there's apps that you can look things up. I have my favorite products list on my website too, if you don't know where to start. But those are two great places. And I just want to paint the picture for someone. A phthalate is a type of chemical when you wash your clothes in detergent and you can smell that, or you walk into an elevator and someone's just left and you can smell their perfume or their cologne, or you can smell something. The reason you can smell it because it lingers is phthalates. Phthalates make things stick around, make these smells stay. Phthalates have been shown. Let's say I'm pregnant right now with a boy. When you are exposed in pregnancy to phthalates, it reduces testosterone. They're an anti-testosterone chemical. And so when you're exposed in utero, like if a little baby boy is exposed to a lot of fragrance and phthalates, it can actually reduce his testosterone and affect the development of his male reproductive organs, which affect him and his fertility when he grows up. So a lot of the fertility issues we're seeing with male factor most likely came from a lot of their exposure when they were little babies 30, 40 years ago.
Holy
I
cow.
know. It's crazy. It also affects PCOS. So PCOS, polycystic ovarian syndrome, is the number one reason for female infertility. And more research is showing that toxin exposure in utero of those little baby girls is epigenetically setting the stage for PCOS type patterns when they are adults. So we're looking at these 20, 30, 40-year olds who are all trying to get pregnant right now. And we're like, what is going on? And part
But
of
they
it
do all
is,
have PCOS. Like everybody I know has that.
yeah, it's a big deal. So part of it is the like toxins we're exposed to right now currently. But part of it was also a lot of the toxins they were exposed to when they were being developed. So, not to say this to scare you, there's still so much that you can do to shift and reduce it, but for healing our next generation of people. We as people, as mothers and fathers who are trying to bring the next generation into the world, we need to be more conscious of that because in the 80s, 90s, we weren't. And now we're seeing the consequences of that with all of these little babies who are now grown up and trying to have kiddos. And so it's not just immediately what's happening, it affects everything because they're endocrine disruptors. They disrupt our hormones. And the most vulnerable time that our hormones are being impacted is in utero and during puberty. So important times. So diet, toxins, looking at stress. Stress is a tough one because I feel like a lot of us are stressed. It feels very cliche to be like, reduce your stress. But I think
It
learning
is
how
cliche, but
it's
how
so
do we do
cliche.
it? Like,
I know. I do, and I teach this in one of my programs too, because I feel like what I've seen with patients and clients is everyone's like, yeah, stress, blah, blah, blah. And they roll their eyes and it's an eye roll because everyone knows it affects, but no one actually knows what to do about it. And so there's 2 points, right? There's identifying what is stressing you out, what is behind what's stressing you out. So a lot of times this goes into deeper patterns, which I feel like you would be really into.
therapy.
Yeah, because if you're like, "Well, I'm stressed because I have so much on my plate." It's like, "But why do you have so much on your plate? What are you saying yes to? Why can't you say no? Where does that come from? What belief system did you adopt as a child or that you have created that you're a people pleaser or that you can't say no or that you are always busy?" Because sometimes to just tell someone to don't say yes to that, it's there's a pattern much deeper behind that.
And they don't have boundaries to not say yes yet,
Exactly.
right?
So there's that whole picture. And then there's creating more stress resiliency, which is a whole other thing of just being able to feel moments of stress, but come back to a normal state. And a lot of us, because of our lifestyle, we're on social media all the time, we're not sleeping, we're not eating well, our hormones are imbalanced. We have this heightened sense of stress where something that maybe wouldn't have impacted our ancestors or another person or a friend impacts us because we're already living at this heightened state all the time. So, learning these lifestyle hacks to get our body back into this good flow of what it wants to be as far as hormones, connection to nature, and all of these things, so that if we do have a stressful moment, we can process it, move it through our body, and get back to a stable ground versus constantly living at this high state. Because with fertility, especially, we have 2 different nervous systems. We have our parasympathetic, which this is a big player in birth, which I'm sure you talk about all the time. Our parasympathetic is our rest, digest, reproduce, and birth nervous
Yep.
system. And then our sympathetic is our respond to stressful things. We need both. And when we're constantly living in that sympathetic respond to stress state, we are not in the physiological place to reproduce and get pregnant. And the same thing goes for birth, right? We need to be in that parasympathetic place to give birth because these are designed intelligently to protect us. If we're being chased by a tiger in the middle of labor, our body's going to clamp up and stop birth to protect us. The same thing goes for fertility. If our body is perceiving that we're living in a state of famine because we don't eat breakfast and we just drink coffee, so we're flooding ourselves with caffeine and we're not sleeping and we're super stressed, even though that stress might be from your commute to work or a stressful job that you don't like or watching stressful shows all day or whatever, it is going to intelligently prevent you from getting pregnant because it's like, this is not a good place to bring a baby into. So let's not get pregnant. It's intelligent.
Well, and doesn't the cortisol hormone, because you're flooded with that, prevents it anyway? Like that's one of the major, your body goes, that's not a safe environment for the baby.
Yep,
Like that, the
exactly.
bottom line,
There's
like you might want one, it's not safe to bring humanity into your house,
exactly,
right?
exactly. So it's not only energetic, but it's physiological in the sense of your hormones literally shift based on which state you're living in predominantly. And so I see this a lot. I had a practice in Southern California for a long time. And so I would have a lot of patients who are quote unquote healthy. They ate perfect.
They
They exercised
exercised.
perfectly. They did all these things, but at the base, like, energetic level, their stress was just off the charts, either because they had to keep up with living in Southern California to survive and pay the amount of money it takes to live there, or they were stressing out so much about being healthy. So there's this balance that has to come. This fertile feminine energy is what I talk about.
Yeah, that needs to be a t-shirt. I was gonna mention that to you. Like, that needs to be a t-shirt.
I know it does. Good idea. A hat and a water bottle. We'll get a whole
I'm
combo and
just
sell it as a
saying,
package.
look, get your merch going.
Yeah, because there's a balance, and I understand for someone who's brand new to all of this, it's like, "Oh, there's toxins," like, whatever. This is why I do teach the things I do, but there is this healthy balance where you need to know what to do, how to navigate the world. I wish it was a part of our culture and it was easy and it was default, but it's not. And then there's also this surrender piece, and the same thing, there's so many parallels
Ugh,
between fertility and birth.
I know. I'm like, I know. I hope she's gonna talk about surrender.
I
Yep.
know. Yeah, there has to be a surrender piece, but this is where I'm a huge fan of investigating because I know based on our path. Let's say I just did the whole, I'm just gonna try and pray and surrender that it's gonna happen and never tested my husband and never knew that he has like no sperm. We would have tried for our entire lives and never had children.
And you would have felt the full weight of it. It's all you.
100%. And so this will segue us into male fertility, but there is a balance. And this is something I had to learn. Not only have I had to learn it with supporting clients and patients, but I've learned personally in a very hard way this balance of knowing the things, doing the things, and also practicing surrender because we're not machines. You can't just push the buttons and expect it to perform the way that you want it to. But with that, there's this healthy balance of, okay, how do you investigate your hormones, making sure you're ovulating, making sure you have enough progesterone so that you can hold a baby and not miscarry over and over again, making sure that you have all of these things in place, making sure that your partner has healthy sperm. Doing this investigation early, which is why my soapbox earlier, I wish that was just done first and foremost. The first thing we all do, everything looks good on paper. Great. Now we learn how to be healthy, how to eat well, how to reduce our stress, how to be mindful of toxins, how to move in an appropriate way, not too much, not too little, just like how to live a healthy life, how to be the healthiest we can be. That's step number 2. Step number 3 is living in this fertile, feminine surrender place. Because when we step into our masculine of control and I'm going to manipulate it to be exactly as I want it to be, and all of these energetic ways of being,
Which plays
that
into the I don't trust anything other than myself to
exactly
keep
it
myself safe,
it
right? So there's
blocks
no surrender
fertility.
there. Yeah,
I
it
know.
does.
So I get it. Like step 1 is not surrender. Step 1 isn't surrender. You have to know what's going on because if you just surrendered from the very beginning, for sure, some people it totally works out. They just get pregnant. That's awesome. And I'm so happy for them. But in certain circumstances, my husband's case in particular, that would have never worked out. So investigate, make sure everything's good, optimize your health as much as you can, and then you practice this fertile feminine energy of surrender. And it's until you get to that place of peace. It's why so many people have the whole mantra, which is so annoying when you're going through infertility, to be like, just relax and go on vacation. Because it does happen for a lot of people because they are in their parasympathetic nervous system, they're relaxed, they're in a space of surrender and peace. And that is when energetically the body's like, oh, okay, we can have a baby now. And then
Which
it
is
happens.
why we adopt a baby and then we get pregnant 2 months after we
Exactly.
adopted a baby, right? Because we're going like, "This is my family." And you finally exhale.
Finally find a place of peace. But for some people, like just finding the place of peace and reducing your stress isn't going to work. Like along my journey, everyone's like, just go on vacation. And I'm like, okay, my husband has no sperm. That's a great, thank you for that advice. I know that. And that doesn't matter how many times we go on vacation, there's literally no sperm
It's not
coming
gonna
out
grow sperm.
of his body. So I like appreciate that you like have this advice and you don't know what's going on. And so this is where there's a balance, right? And if you ask anyone going through infertility, it's probably the most triggering thing to be told. And there is a huge truth to it. So many people say it because it happens so much. where people get into that place of calm, relaxed, not stressed, surrender place, and that's when they get pregnant. So it's like a tricky thing to navigate, and this is why I just think about how much time and effort we spend in education and other ways, and why this isn't a part of our culture because everyone should just know this. Should just be like everyone knows how to multiply numbers.
Well, we don't even know what our cycles are. We don't
I
know what they're
know.
for. We don't know anything about hormones. We don't know our luteal phase from anything else. We don't know anything. We don't know how it's connected to nature. And I think that's one of the things that I struggle with, even in the birth and labor population. We are so disconnected from nature that we want the baby to come at the right time because we've
Yep.
got a date now. It's 40 weeks. That is the day my baby is
Right.
supposed to be born.
Yep.
And nature has never been set up like that. Like, we don't put flowers on a rotating schedule of a certain day, but we're so disconnected from it that we don't trust our bodies. We don't trust each other. We can't just allow it to happen because if we can control everything, nothing bad will happen. Sometimes that control is what makes the bad things happen.
Yeah, exactly. And this is a space where I feel like I can speak to this because people will be like, if you've never struggled with infertility and you've never struggled to get pregnant, it's really easy for someone who is struggling to be like, you don't know what you're talking about. But there is this reality to like, okay, there are all of these forces at work. And I'm a person who can hold lots of ideas at the same time that kind of contradict each other, but need to be together. For example, like I mentioned, it's important that we investigate and know what's going on with our fertility. And sometimes maybe your soul needed to go through something hard, like infertility, or maybe you not understanding a certain thing and then learning about it is going to push you to do some deeper work that you needed because your baby needed you to not have that baggage anymore. Or sometimes I've had patients who come in and they're like, "I need to conceive in November because I have a conference next summer." I'm like,
Oh, yeah.
"Okay, your baby might wanna be an Aries, and
Right.
it's like, you have no control over that." Like, there might be a much bigger plan at play that has nothing to do with your conference, and there's just so many parts and pieces at play, and that's my beef with the IVF space too is not all doctors at all. I love my IVF doctor, he's great. But there is this mentality of we can manipulate and control this to be exactly what we want. And people I think are shocked when outcomes are still poor with stuff like IUI and IVF. And we aren't these mechanical devices where you input the number of this is what I want and this is the output that I want. You're co-creating with another soul, this baby that was wanting to come into the world, and you might need to become a certain person before they come, or they might need a certain thing, or maybe want to be born at a different time. And that can be really triggering for some people going through the infertility journey to hear that because they want to be pregnant yesterday. Or if I tell someone, let's take 3 months and work on your health, it's like, no, I need to be pregnant. I need the baby before Christmas or whatever. And this is where the surrender piece comes in, where I get it. It's so hard to not have exactly what you want exactly when you want it, same with birth, right? But sometimes there's so many other factors at play. We do our part, we do the most we can do, and then surrender to the fact that there's probably something bigger happening as well.
And I put it to parents when they're like, I have to have my baby by, that 40-week date. God, I hate that 40-week date created by a man to bug us, is what it was. To control nature. It's like
Yeah.
you can't control the tides, folks. It's just
Yep.
impossible. But we all have those people in our lives that once we met them, it shifted us into our career, or it got us the job we needed, or it got us to our partner, or it whatever it led us to, because the right timing of that person showing up shifted the whole trajectory of where we were going. And we look back and go, "Oh my God, that was amazing." Your baby has the exact same future.
Yeah.
The timing for them to come in is going to get them to meet those people that are meant for them to
Mm,
create the life that they're
some
supposed to
chills.
be,
Yeah.
right? And if we're preventing and controlling and whatever, not only are we shifting their dynamic and their path, are we shifting those people out because now their path is someplace else? Do I still think it's meant to be? Absolutely. But why aren't we allowing them the same good fortune that we have had? with the timing that we've experienced in our lives because it is a bigger picture when we're bringing a soul in. It is not about, I have a baby. Now I've got my 5.3 kids in this house and I can take family pictures anymore. It's way bigger than that, which is why I think we do need to start the humanity piece early, like with
Yeah.
little kids and grow
Yeah.
up with that knowledge and information.
Exactly. Yeah. So it's such a balance because there's a lot of people in the manifestation world. It's like, just manifest the baby, it'll come. And I get that. And there's still work that needs to be done, right?
Yeah.
And there's still things that we need to be aware of. And so it is this really healthy balance. And you just can't have one or the other. They have to go together, in my opinion. This whole doing the work, understanding the things that need to be done, and also this practice of surrendering, getting on energetic frequencies, understanding that there's a bigger picture and they go together at the same time. And you just kind of have to hold them both. And that brings me to male factor, which we wanted to talk about. And the number one thing I just think people need to start with off the bat is testing their fertility. I'm just such an advocate for that.
So explain that. Is it as simple as saying, before we even try, we're going to test that sperm?
Yes, it's that simple, and it's so simple for them. They literally ejaculate in a cup and send it off. It's like, it is
Wow.
not that hard. You guys can do it. I know you can. It's just, come on. What is the barrier? So you don't even have to go to a doctor. There are direct to consumer labs, things like Legacy, Meet Fellow, where you can do it in the comfort of your own home. But male fertility is so neglected. This is my next soapbox. And obviously, I'm biased because our issue is male factor, but 50% of infertility is male factor and 50% of miscarriage is male factor.
And
So
nobody talks about that. As
I
women, we have walked
know.
around with this shame of I can't conceive and I keep miscarrying.
I know. I've had patients who have been working on their health for a year or more come into me. They're so distraught, can't get pregnant. They're doing all these things. They have lists and all this stuff. And I say, okay, well, how's your husband's sperm? And they're like, well, I don't know. I've never checked it. And I'm like, oh my gosh, this
Well,
is
I'm glad you've
crazy.
taken care of yourself and you're in
Yeah.
an optimal
Yeah.
position.
I'm glad you're
But
great. And it's just because I've been on many podcasts talking about male fertility, and people are like, why is it like this? And there's so many reasons why. Part of it's cultural, part of it's men's ego, part of it's they don't even know unless their doctor says to do it. People don't even know they can test their sperm. So, first and foremost, as soon as a couple is together, because I always say women are the main people who go to doctors, I would say, for the most part. But male fertility issues is a woman's health problem. And I can speak to that personally. The heartache, the financial burden, the
mental load.
like the devastation, that's the word I want to see. The devastation for a female who wants a baby more than anything is biologically driven to want this baby and can't because of her male partner. It doesn't just affect him. Him not looking at it is not helping anybody. Him ignoring or pretending, "Oh, I don't have a problem. There's nothing wrong with me." I see this a lot in my
Yeah, it's
patients.
ego big
"Yeah, there's
time.
nothing wrong with me. I can get you pregnant." Blah blah. I don't care what you think until you test and show that you have normal sperm or normal hormones. Don't say that, because don't put your female partner through months, years of agony every month checking to see if her period came and doing pregnancy tests and stuff when the whole time it could be you. I just wanna shake these guys to be like, "What is wrong?"
What's normal? Are they looking at sperm count? Are they looking at hormones and sperm count? Are they looking at density? What are they looking at?
So, I typically recommend first pass, just do a sperm test to just see where we're at. Looking at count, the morphology is the shape of the sperm, so how it looks. Does it have 2 heads? Are there 4 tails? What's going on? And then the motility, which is how it swims. In order to get pregnant naturally, having sex, the sperm, there needs to be enough of it, and it has to be able to swim straight. If it's just swimming in circles, it's not gonna get you pregnant. And the way that the sperm is shaped tells you about the DNA of it. Is this healthy? Have you been in a nuclear war zone? Like, what has happened to the shape of your sperm?
Because those environmental factors definitely,
Mhm.
I've had a lot of military couples that have gone through that because of
Yep.
all the stuff they've been exposed to.
Yeah, exactly. So anything that breaks down or affects our DNA is going to greatly affect sperm. So sperm are very interesting. They're just blobs of DNA. When our eggs are our DNA as females and sperm are the DNA as males, they're half of the genetic code. And when they come together, they form one full genetic code, which makes a human being. So they're just little blobs of DNA, but they're very easily impacted, positively and negatively. So, a lot of things can greatly impact them, like toxins, heat, diet, all of these things. But in the positive way, removal of toxins, removal of heat, healthy diet, certain supplements could really improve them greatly. It's amazing how fast sperm respond. But first and foremost, just getting a sperm test, seeing, do I have a normal count or is there something severely wrong? Do I have a really low sperm count? In my husband's case, would have identified right away that there was a blockage or a genetic issue because we could have tried and tried forever and ever and ever, and it would have never happened. Or is there a motility or a morphology issue telling me that I need to investigate further or really work on my health? If there is an issue, you can also look at certain markers and hormonal markers. I have a lot of these resources again on my website, but I don't think guys need to run hormones right away. If he does a sperm test, let's say, and the count is low, then you might want to check testosterone. Is this a testosterone problem? Is this a different kind of hormone problem like thyroid? Is there a metabolic picture at play? Does he have diabetes or metabolic syndrome, which can affect the sperm? Or are we looking more at your lifestyle? So,
It's smart that it affects the sperm so we don't reproduce from a
A
bad
hundred
male.
a
You
hundred
know, not like
percent.
you're a bad guy, but I'm just
Yeah.
saying there's a reason we don't want any more of you running around if your health is bad, right?
Yeah,
To
exactly.
protect species.
This is why fertility is a side effect of optimal health, because we are not meant to reproduce unhealthy genes. We're not meant to pass on unhealthy genes. And this is where it is tricky, again, when we go down paths like IVF and stuff, where we're forcing the hand, and why I'm so passionate about it, even if couples have to do that, why it's so important to optimize both of your health before so that your eggs and sperm are as high of quality as possible. Because a lot of IVF doctors, they'll see a low count, a low morphology, and a low motility, meaning the sperm, there's not a lot of sperm, they're unhealthy looking and they can't swim. They're like, oh, that's fine. We get around all of those with IVF. Cool. But do you want to inject an unhealthy gene into my eggs? That's not
Right.
great. And this is why there's slightly higher risks in IVF babies of autism and health issues and all of this stuff. I don't think it's because of IVF. I think it's because we are choosing less healthy gametes, less healthy sperm and egg, because we can get around these issues that nature weeds out.
Wow. It's all about just I can get you pregnant at that point,
Yeah.
which is more ego.
Yeah. And again, why there's a lot of poor embryo quality issues, a lot of failed transfers, more pregnancy complications. It's because it starts with the health of the egg and the sperm. And when you can move around those obstacles without actually improving the health of the egg and the sperm, it causes problems.
But they make a lot of money every time
Yes.
we try it.
Every time we fail. Yep. It's a bummer. And not all of them are in it to just make money. Like they really want people to get pregnant, but the system is set up as such. It doesn't bother them that much that something failed and you have to do it again. Whereas in my mind, it's like, why not take the time to optimize and have everything as ideal as possible, even if you have to work around these issues? Like in my husband's situation, he had a genetic issue where the sperm could not come out of the vas deferens, which is the tube that allows the sperm to come from the testicles out of the body. And so we had to go in there surgically and get sperm. But if we didn't take the years that we did detoxing him and getting him as healthy as possible, those sperm that they're going to retrieve were not going to be very healthy. And so even though we got to utilize the benefit of IVF to get around this issue of him not having sperm coming out, we wanted the sperm that he chose to be the healthiest possible. And my daughter is amazing. She's like, I mean, I don't even know. Who knows what it's from? It's amazing that she was plucked from his little testicle. But I just think that the work that we did ahead of time really changed that outcome. And I've seen that with patients myself. So people listening, I've had people be like, "Well, I don't need to work on my health. If I have an issue, I'll just do IVF." And to me, that's not a solution because even if you go down that path, you still want to be healthy. It still impacts your children. So with male fertility, they're very neglected. Testing them early on and just learning some of the basic stuff to help them can be huge. Again, I have a lot of resources for this, but you can look stuff up too. There's books that you can read. Actually, there's not that many. I should probably write one because there's actually not
There's
that
something
much.
else for you to put on your docket as you're gonna become a parent again in November.
Right. There's not super great resources, which is why I've created a lot of them because The Countdown is a book that has come out recently, but she's more a researcher who's drawing attention to how much toxicity is affecting male fertility versus these are all the things that you could do. There is a small segment in the Real Food for Fertility book that just came out with Lily Nichols and Lisa Hendrickson Jack, which we've both had on our podcast that talk about male fertility. But there are a lot of places that you can find to how to support. But that's first and foremost. And another thing that it's a soapbox because even in the conventional model, they just don't care about male fertility. And it blows my mind.
It's not even talked about, and it's ego, it's cultural.
Mhm.
I think women have carried the burden of fertility for so long, we just don't even go there, and some relationships are pretty delicate, which is another reason we need therapy, because if it's too delicate that you can't even say, "Dude, this is a cup. You need to use this." If we really want a family, we have to be open and honest about those things. How are we gonna be open and honest about all the things that come with parenting,
Yeah,
right?
exactly.
Yeah,
I think,
it's
yeah, if you're with a male partner who refuses to investigate because they're sure, because male fertility, this is the thing, both female and male fertility can be kind of silent, but I would say with women, there's maybe more signs, not always, but we have a period every month. We can kind of like track. With men, it can be totally silent. You have no idea. Like there is nothing anatomically or physiologically wrong with my husband. There would be no question at all in my mind that he didn't have sperm. There would have been no way to know. And I happened to find it in a microscope in medical school. So, like, we weren't even trying to conceive at that point.
Whoa.
Yeah, we just we had to get a
How did that
sample.
conversation
Oh,
go?
it was terrible because I was in my sperm analysis class. We weren't trying yet. I was only halfway through naturopathic medical school. And so I needed a sample. I was like, honey, I need a sample. We're going to look at sperm under the microscope today. And he's like, okay. And I'm literally in class trying to make slides and look for his sperm. Everyone's, oh my gosh, look at all the sperm because they're really cool to see under the microscope. They're little and they're so fast and they just squirm everywhere. And I just kept making slide after slide and there was nothing. And my heart just dropped because I didn't even think it wasn't even on our radar. I just assumed I would graduate in 2 years and we'd get pregnant. I was super healthy, he's super healthy. I had no idea, and then I had to break the news to him that night. He's like, "How'd my sample go?" And I had to be like, it wasn't a doctor sitting us both down. I had to sit him down and be like, "You have no sperm, and I don't know why, and we're gonna figure this out." I went into full doctor mode. I couldn't even let myself get emotional, and it was a really hard journey for us because I walked that line between when there's a male factor, it's really complicated because me as the female, just naturally, I'm more of an external processor and griever, but I couldn't really bring that to him because it made him feel so bad. Like, he
Yeah.
felt so sad for both of us, for me, he felt less of a man and all of these things, and so me being like, "I want a baby so bad and I can't get pregnant." Obviously, I would bring that up to him, but I had to do so much of my own emotional processing with a therapist and with other people. I couldn't do it with him because then it would spiral him into a really dark
Oh, it
place.
would be devastating for him. I can't even
Yeah,
imagine.
it's devastating, and he was amazing, and he did all of his own work around baggage, and he's awesome, like, he's super open about me sharing. He never went into a weird place of insecurity, which I really appreciate about him, but I know a lot of men really struggle with that, and he just did a lot of work to get to that place, but it's hard when it's male factor because when it's female factor, for me at least, I could imagine like crying and being sad and my partner's like comforting me because it's not like it's my fault. I don't like using that terminology, but it's just different than when it's your issue, but I'm really sad and I don't know where to go to get support because you're having your own experience. You're not the best support for me because you need your own support. And it's just
Ugh.
complicated. And then for me, throwing in the fact that I was a doctor, a root cause naturopathic doctor on top of it, trying to figure it out, there were a lot of levels and layers. So our infertility journey taught me so much and why I have this like unique perspective. And I went to a lot of really dark places and have come out better for it. But I understand what people are going through to some degree because it's tricky and there aren't a lot of things set up in our culture to navigate that situation for women or men.
Well, and the thinking of that there's no mistakes out of all the men you could have picked for your partner, like this would be it, and that you're going to work on fertility as your life's passion. It is the way it is. And I look back at my miscarriages where they were so devastating and so heartbreaking. And I didn't have the partner that actually cuddled me through it. He was relieved every time I had a miscarriage, which I understand now because of all of his stuff. But going through that has allowed me in my birth work to hold those spaces for I've had 4 miscarriages, now we did IVF, now this baby's here, which they still wanna mechanically control everything because they've lost so many babies. I 100% get that, but you're also baking your baby in that fear. So how do we allow for this process? Your body's working magically now. You're carrying this baby to let that go because you're still looking at your underwear every day, waiting for the bleeding to start. And I did that with Finley. So I understand that point of view. I wouldn't wish that journey on anybody, but I also don't second guess it now that I can look back on it. And I always believe our pain is for a reason, even though it's unexplainable, wrong, and why are we going through it? Or why are we a victim of it, depending on the situation, but yeah,
Yeah.
there's somebody we're helping with that, and maybe it is just us because it's putting us on a different road.
Yeah. I agree. I feel like as a doctor, I actually really struggle with this because I want everyone to be healthy. I don't want suffering. I want everyone to be in this beautiful, blissful place without any struggle. And I know that so much of the richness and the goodness that often comes into people's life from their passions or whatever come from these moments of struggle. So it's like, how do we again hold both of these concepts at the same time? Because I don't believe that we're all meant to just suffer and not be healthy and not take care of ourselves. And at the same time, I think it's through these dark nights of the soul or these challenging moments that if we take the opportunity to turn it into something good and beautiful, can be our biggest blessings too. I if there's something I could wish upon anyone, it's learning how to process the shit that happens, right? Because shit happens to every one of us in different ways. Learning how to process that and turn that pain into something productive or into something beautiful. There's this quote that someone said that the universe is rigged in your favor. And again, that can be triggering to someone who's in the middle of something really hard. But I personally have found that to be true when I look back on my life. But I don't think I would ever have gotten there without all of the work that I've done, processing, releasing baggage, releasing trauma. Because if you stay living in that victim space, it never feels like that. But sometimes when things get hard, because I've been through so many hard things, in a moment of hardness, I'm now at the place where I can sit back and pull out sometimes, even though it's like really challenging and say, okay, if it's true that the universe is rigged in my favor, how could this be true now? This really crappy, shitty thing that feels so hard. Could this actually be rigged in my favor? Could this thing that I wanted to happen this very specific way that's not happening actually end up being the best thing that happens? And getting to that perspective only comes from doing a lot of work So that's the other thing that I just wish people could do before they get pregnant, if possible, or along the fertility journey or along the parenthood journey, wherever it is that things get hard for you, because that's another part of our culture that is not supported very well. People don't know where to go or how to do that. And not every practitioner works for every person. Like my husband doesn't do well with talk therapy type of stuff. He needs different types of practitioner, more energetic healers and stuff because he's not an external processor. And so just having people find all the different types of practitioners out there that can help you process, move through, and get to these places, I think is probably one of the best things you could do along this journey, no matter where you are.
When you say dark night of the soul, my stomach goes,
Ooh,
oh, I think I've had
I
a
know.
couple of those. Yeah, I remember it. 14 days once, right around my divorce time, where I was just deciding, am I going to do this? Am I not going to do this? How do I raise two kids that both have their special stuff
Yeah.
by myself? And I'm just sitting there crying solid. I was so dehydrated by that
I
time. And
bet.
I just kept thinking, how do I get through this? Because it was that moment realization that it's actually all on you and you can do it. I don't know how you're going to do it, but you're gonna do it. And it was just the layers of abandonment and all. I mean, it brought up everything, right? I look back now and I'm like, that's what that was my switch. I'm so grateful for those 14 days, but man, those 2 weeks, I thought if I didn't have to leave my kids, I wouldn't have been here.
Yeah.
I was in that kind of torture. So
Ugh.
yeah, I understand doing the work is the hardest thing and it's the best thing. And there's people that can help walk you through it. I think especially when it comes to fertility stuff. And I want to switch on to a little bit lighter
Yeah.
topic just as we wrap up because I didn't ask this earlier and I should have. I would like to talk a little bit about the probiotics, the supplements, and the
Mhm.
omega 3s and stuff like that. I was recommending Needed before I knew you were a formulator with it.
Yeah.
So, yeah. So, please talk a little bit about that as we wrap up so that they know where they can start getting that kind of health and optimization.
Yeah, absolutely. So we talked about the foundations of health, diet, the toxins of stress. Another really easy way to support you is getting good supplementation. So unfortunately, our food system is just not what it used to be. The food that our grandmothers or great grandmothers ate is just, it
Yeah,
was
you have to
different.
say great grandmothers now, don't you?
Yeah,
Great
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 grandmother.
grandmothers.
Exactly. They've done studies that show that the food back then was actually more nutritious. Like a tomato back then was more nutritious than a tomato today. So it's unfortunate. I wish that it wasn't that way. But in this world of fertility, we're not only working against that, but also with all of this other stuff that we're inundated with, toxins and all of this stuff. And so we need more nutrients. And it's a big reason why I'm so happy to have been a formulator for Needed, which is one of my favorite supplement companies. Obviously, I help formulate their products. So I think they're the best. And so a lot of people ask me, what should I be on prior to pregnancy and what kind of supplements? So I love Needed's prenatal. That is one that I recommend women get on before. You could be on it for years before you get pregnant. It's all of the nutrients that your body needs at a much higher dosage, and what I also recommend during pregnancy and postpartum for those same reasons. And then omega 3s are amazing. So, omega 3s come from fatty fish, unless you're eating wild caught salmon 3 or 4 times a week, which, if you are, awesome. But
Who can
most of us
afford
don't.
wild caught salmon
I know.
3 times a week?
Most
Oh
of
my
us are not
gosh.
doing that. I know.
Wow, that's a lot of
So,
money and good
exactly,
food,
which
but
is why
wow.
fish oil yeah, which is why fish oil is so beneficial because a lot of it's made from anchovies, sardines, things like that that are cheaper, but people aren't eating, and they benefit fertility greatly. So males and females, both omega-3s are amazing for that. Probiotics, so your microbiome, which are the gut bugs, and well, they're the bugs everywhere. You have it on your skin and your vagina, your gut. Having a healthy microbiome is super important for getting pregnant and staying pregnant. And so Needed has an amazing probiotic formula. So speaking of the women, and then I also help design a fertility line. So helping support egg quality. So they have an egg quality support. For the men, they also want to be on nutrients. Like I said, sperm are so easily influenced positively as well. So getting him on a good multi omegas, and then Needed has a blend of like sperm support herbs with their probiotic. It's called their Sperm Support Plus. So I love that. I helped formulate it. Obviously, I love it. But just
Right?
those kind of things are super basic. And then also their CoQ10. So CoQ10 is one of our major antioxidants. It's really great for egg and sperm quality. It's actually one of the supplements, even in the IVF world. They're like, yeah, CoQ10, because there's so much research on it. And so all of those Needed has different fertility bundles and packages that you can do with fertility, but those are like the essentials from a supplement perspective that I typically recommend people are on, unless there's some rare, unique situation when you need other things. But that's another really easy, good place to go. But I love them. So diet, supplementation, stress, toxins, movement, working on your baggage. These are all the things that we want to do before we get pregnant.
Oh my gosh, there's so much. And this show you could listen to 6 times and take more notes every time, I think. There's so much in it. And you do have courses, you do have things that they can start on with you to work with you. I just appreciate your time and energy being here today. It's going to help so many people like really sort out. It's a much bigger problem than they think, but there's solutions to it. And I think
Yeah.
that's, I didn't realize sperm was that easily influenced. I'm happy for that
Oh,
sperm.
yeah. Yeah. Well, and one thing to remember before we wrap up is anything that you shift or change in a man's life, it will take about 72 days to show up in the sperm because that's their life cycle. So let's say you want your man to stop drinking or get healthier. Wait at least 72 days after that before you start to conceive, because the sperm that are ejaculated were made 72 days before that.
Well, and
So,
that's kind of
fun
funny
little
because
tip.
our egg quality is the same thing, right?
Yep.
Like
Yep.
the egg that we're waiting for to come up is 3 to 4 months. So if we're in
Mhm,
high stress, that's the
mhm.
egg that's going to come because they have to survive your stress.
Yep.
So if you want a mellow kid, be mellow
Be mellow for 4 months.
for 4
You can do
months.
it.
Stay out of the cortisol shit show and wait for that mellow baby to show up instead of the
Yeah.
one that's mastered the survival techniques that you're dealing with every day.
Yeah, exactly. So 3 to 4 months for
Crazy.
both partners is ideal. Mhm.
Okay. Well, I will see everybody next week. Thanks, Leah.
Sounds good. Thank you.
Thanks for joining us today. And remember, it's your body, your choice, and finding your voice is your power. Be sure to subscribe to our YouTube channel, follow us in all the places, and go to birtheducationcenter.com for our blog and more online education classes. And we'll see you next week.